Now, Human Rights Watch has launched its report on the impact of lead contamination in Kabwe province in Zambia. Now, the report says that lead exposure around former lead and zinc mines in Zambia is having disastrous effects on children's health. For more on this, we're joined now in studio by Children's Rights Fellow at Human Rights Watch and author of the report, Joanna Naples-Mitchell. Thanks so much for joining us. Welcome to the program.
Thanks so much for having me.
All right, so this is a story close to my heart. I was actually born not far from Kabwe in Chingola in Zambia. So mining, the copper belt and other mining is a very important part of the country's history.
It is, yeah.
So it's quite concerning that years after some of these mines, the children in particular continue to be exposed.
Exactly.
All right, so tell us what you found.
Yeah, so what we found is that this mine in Kabwe, a former lead and zinc mine, it was in operation from 1904 to 1994, and even though it's been closed now for 25 years, there's still lead in the soil around the mine. So we weren't testing the soil ourselves, but there's actually very good studies that are pretty recent that show the soil is very contaminated. But what we found is that the government's efforts to clean up the lead and to provide health interventions for the community were really insufficient so far.
All right, we'll talk about their interventions, but let's assess what's been happening for the children in particular that are exposed to this. What sort of symptoms did they display? What are the effects?
So first I should say that I'm a lawyer by training, I'm not a doctor. So if I speak about symptoms, it's what parents told us their children experienced, and then I would have consulted with a medical expert after to say, which of these are actually consistent with lead poisoning. I mean, so parents told us about children who had headaches or severe stomach pain or who had memory or concentration issues in school. They spoke about stunted growth. And all of these symptoms are consistent with lead poisoning, but we actually have no way of knowing if they're actually from lead poisoning or not. But it's more likely than not that at least some children in the community have symptoms from lead poisoning.
So it's in the soil, you play with the soil, and that's how you get exposed?
Right, so the lead is in the soil and also in the dust, so if you inhale it or ingest it, then you get exposed. And so if kids are playing on the ground, they're playing games, the cover of our report is actually 3 girls playing a game in the soil. If the kids, especially young children, put their hands in their mouths a lot, they're likely to be exposed to it.
But the government has had cleanup campaigns and efforts. Why do you think they perhaps haven't been as effective as they ought to have been?
Well, I think first, they haven't addressed the full scale of the problem. The cleanup efforts have focused in the past on homes and schools, which is very important, but there's also lead dust on the roads in Kabwe in certain areas where there are unpaved roads, so cars going by will kick up that dust. And additionally, even the remediation, the cleanup done in homes and schools was actually just mainly planting grass or providing a bit of new clean soil, which over time goes away. Zambia, especially Kabwe, has a dry season and a rainy season that will both kind of slowly get rid of the grass in the soil. People told us that water was very expensive, so it was actually very hard for them to maintain the lawn, which would be needed to protect themselves from the lead in the soil.
All right, so have you engaged the Zambian government with these findings, and what did they say?
Yes, actually. So we had a very constructive exchange of letters. We sent them a letter in July with our findings, our key findings and recommendations, and then they sent us a response saying, this is what we're planning to do now. They have this new World Bank funded project under which they're planning to do new cleanup and they're planning to do new health interventions. So we have engaged with them. But I will say too that we had hoped to have a press conference in Lusaka, in the capital of Zambia this week, and had planned to up until last Monday when we got a letter from a government official in the Ministry of Mines who said that we were not allowed to proceed and that this was an attempt to discredit the government.
So they didn't want you releasing this report, is that what you're saying?
Exactly. We did this report because we want to provide recommendations for how the government can address this situation. We know they have this funding from the World Bank. We think it's really a positive step, and we want to see them act and do what needs to be done in Kabwe.
So is the gap in terms of they didn't know what to do in the cleanup, or is it that they didn't have enough resources?
It's hard to say. There was a lot of money under the last project, and it's the way it was allocated may not have been the most wise. Just given the fact that there was this grass planting effort, they actually created this new water infrastructure when really that's not going to be sustainable for solving the problem of lead in the soil. But I think, if there's a question of resources, our report also calls on donors to support the Zambian government in its efforts. There's a lot of actors who can be part of the solution in Kabwe.
Right. So what about health facilities on the ground there? I mean, are they equipped to recognize some of these symptoms and deal with them?
So, there have been periodic trainings over the years. I know there were under the last big World Bank funded project from 2003 to 2011. And actually this month, the government just did a new training of 30 health workers on recognizing those symptoms. But when we were there last, especially when I was there last November doing interviews, it seemed like there really were not a lot of resources. And actually there were no test kits left in government health facilities to even test children for lead poisoning. There's no chelation medicine left to treat children who have very severe lead levels. So I think the government is shifting that now, and now they're doing this new training, but it's all very recent and hasn't happened for a long time.
So what are the parents saying and the children telling you about their daily lives around these townships around the mine?
Right. Parents are trying to get by. The people that we spoke with are often very poor. Some are former miners who are now out of a job and have been for many years. They want a good future for their children. They want to know that they're healthy. There's a bunch of schools that are in the areas around the mine too, and so we talked to families whose one child actually her shoes had been stolen and she couldn't walk to school. So a completely different problem that this report wasn't even addressing. That's happening at the same time as having to think about lead.
Yeah. Is there a disproportionate amount of, maybe some kind of illnesses that may be related to being exposed to this that you wouldn't see in other parts of the country, so that maybe it gives us a clue that, there's an unusually high amount of this kind of thing happening in this part of the country?
I think it's something actually I can't really answer adequately. We haven't really been able to compare that kind of data.
Right. Okay, so what are the next steps? What can government do? You're calling for assistance, you've given them guidance. What must they do?
So the short answer would be that the government should develop a comprehensive and sustainable plan for addressing the contamination, which means that it should address all the sources of lead, which include homes, schools, should pave roads. They should also address other public areas or health centers that are contaminated. And it should be done in a sustainable way. So not just planting grass, but either removing the contamination or containing it in a way that will last.
All right. And this can solve the problem once and for all.
That would be the hope. It's a challenging situation, and there definitely are not easy answers. But I think the most important thing is to address it with the urgency that's warranted. And this is a public health emergency. And given this slow response by the government and other actors, it's not really being treated as such.
Joanna, thanks so much indeed for coming in and sharing the story with us. And let's hope that the Zambian government can get the support that it needs to get this job done.
Thanks so much for having me.